That to-do list is growing shorter and shorter by the minute. Now, how Democratic majority leaders are defining this legislative session is interesting. One calls it a sneaky big deal year. Another labeled it a success. The governor says the session reflects, if we said it, we meant it. State House Democratic leaders say success defines the goals of this legislative session. The heavy lifting includes utility rate relief of $150 a year in customer savings and a comprehensive change in the state's energy policy.
Actions that are being taken today will save hundreds of dollars for Maryland's families. Second, big companies will be held more accountable because of this law. Data centers are done dictating what rules they will follow.
Lawmakers voted unanimously to prohibit the use of hotels, homeless shelters, and inpatient medical settings for foster care. The legislation is in response to the suicide death of 16-year-old Kanaya Ward at a Baltimore hotel. She was under state care at the time. Bills to further curb cooperation with ICE are on its way to the governor's desk. The Community Trust Act generated fierce debate in both chambers. The legislation requires a judge's order to detain individuals they believe are in the country illegally. In a one-on-one interview, the governor says he's considering signing it.
I've been very clear with the legislature that my guidelines for that bill are that I believe in due process, I believe in supporting the Constitution, and I believe in keeping our community safe.
Another bill now on the governor's desk prohibits police and federal agents to wear masks during the performance of their duties.
So I'm confused, though, how it applies to federal. So are we under the impression that we can tell federal law enforcement agencies what their uniform is, what they have to wear or can or can't wear during operations?
The governor says he's also inclined to sign another controversial measure called the Youth Charging Reform Act. In a related legislative matter, Maryland regulators voted Monday to cap what government health plans pay for type 2 diabetes drug. The move is expected to save taxpayers money.
The Maryland Prescription Drug Affordability Board did the historic step of putting an upper payment limit on what state and local governments in Maryland pay for high-cost diabetes drug Jardiance. This will save them hundreds of thousands of dollars and thus taxpayers.
Debate in both chambers at times became testy. The speaker admonished one legislator for yelling. The Senate president interrupted discussion because it was uncivil. Reporting live from Annapolis, David Collins, WBAL-TV 11 News.